Hi, I'm Andrew Pope, and physician who's been practicing for well over 10 years. The majority of the patients that I treat come to me with a variety of different diagnoses, the most common of which being arthritis. What is arthritis? Arthritis actually is a combination of two words, arthrosis, which is joint, and itis, which is inflammation. So simply put, arthritis is joint inflammation. But that doesn't really tell us much. What's really going on is what's causing the inflammation. That's what we need to understand. And there's a lot of different pathways by which people get arthritis, the most common of which is just osteoarthritis or degenerative arthritis. That comes from living your life, the wear and tear that we put on our bodies over time. Other people come to arthritis through injuries. They played sports, they had active lifestyles. Oftentimes they had very manual labor type jobs that were very demanding, and they prematurely wear out their knees, their hips, their backs. There are other types of arthritis as well. Autoimmune arthritis is another common cause of arthritis. Rheumatoid arthritis is one type of autoimmune arthritis. That's where your own immune system attacks your own joints and slowly over time destroys your own cartilage. There's psoriatic arthritis, lupus arthritis, and a variety of other types of arthritis. But at the end of the day, what we have to understand is the end result is the same. It really doesn't matter how you got there. You ended up losing cartilage in the joint, and cartilage is necessary to maintain the structure, the range of motion, the function of that joint. And once that cartilage starts to wear thin, you start to notice the weather changes, start to create some stiffness and ache in the joints. But when you're standing on your feet too long, your knee, your hip, your ankle, your low back starts to hurt. You wake up in the morning and things don't want to move, and it takes time to get them moving. These are all common symptoms and signs for arthritis. Normally, it's viewed as a terminal disease. Traditional medicinal approaches don't really have a good fix for arthritis. They start with Band-Aids, and that's usually the only tool that they have in their arsenal. And those Band-Aids will come in the form of anti-inflammatories, such as naproxen or ibuprofen, maybe prescription meloxicam or Celebrex. They're all aimed at reducing the inflammation, but they don't really give you cartilage back. So they don't really get to the root cause of the problem that's causing the pain. The next step might be physical therapy. And you can learn to live a little bit longer with your arthritis, some patients anyway, with some directed physical therapy, but they have to stick with it, be consistent with it, which unfortunately life often gets in the way. Some people resort to injections. Some injections, such as cortisone, can alleviate the inflammation. But the problem with cortisone, and the reason they don't want to do it very often, is because it actually can further accelerate the loss of cartilage. So in one instance, you're using cortisone to reduce inflammation, which was caused by loss of cartilage. But yet that very same medicine can cause further and more rapid destruction of the cartilage. So do you see the problem? They still offer it though, because the traditional approach and the traditional understanding is that arthritis is terminal. So it's the equivalent of jumping out of an airplane. No matter what, you're going to hit the ground. That's the way they view it. And so they view the cortisone potentially as a tiny little parachute. Maybe it slows the ride down. But I'll be honest with you, it really doesn't slow the ride down, it speeds the ride up. It just makes you feel a little bit better while you're speeding up. There's another injectable called hyaluronic acid. That's often injected into people's knees for arthritis. It acts as a temporary lubrication. Some patients may get a few months of relief, but ultimately, in my experience, that's typically all. And then at some point, your quality of life will dictate that you have no choice. It's time to go talk to the surgeon. And at that point, they're going to talk to you about a replacement. And that's truly the last resort. But traditionally, that's been viewed as the typical course or progression of arthritis. And so that's why they offer the cortisone, even though they know it accelerates the arthritis, because in their mind, you're going to end up on their table getting a new joint no matter what. Well, there there are several things we can do to slow that down. And obviously some of them are lifestyle. It's look at the things that you do that seem to aggravate and cause further pain and inflammation. There are certain diets that can lower inflammation and help mitigate some of the symptoms of arthritis. And then that leads me to supplements. There are some really good supplements on the market that can help reduce inflammation, thereby decreasing symptoms and hopefully slowing the progression of arthritis and the associated pain. And that's why I created Joint Life. Joint Life is a combination of 6 different ingredients, all using research and clinical studies showing each ingredient's benefits for arthritis. I used the doses that were shown to work in the research studies, and I combined them all into one supplement. That's why you'll not find anything else on the market like this. At best, you might find a supplement that's got 1 or 2 ingredients, but there's not one on the market like mine that's got 6 different clinically researched ingredients, and the doses that are put in there were the doses that were shown to work. So I've taken what I call the kitchen sink approach. Throw them all into one, a one-stop shop. And my claim is that I can't guarantee that Joint Life will reduce your arthritis pain. But what I can tell you is, if my supplement doesn't give you relief, then it's unlikely anything else on the shelf will. Some people truly are beyond the point of what any supplement or injection or any prescription for that matter will do. But for those of you with mild to moderate arthritis or severe arthritis, but you're just looking to delay surgery as long as possible, go to tryjointlife.com and give us a try. You'll be glad you did.